welcome to today's video. Today we're talking about MS or multiple sclerosis. So let's start with, what is MS or multiple sclerosis? MS is a chronic disease of the central nervous system made up of the brain, the spinal cord and optic nerves. It is an autoimmune disorder, which means the body's immune system is attacking the central nervous system. As of right now, there are no specific antigens, which is proteins that stimulate the immune system. No specific ones have been identified in MS. So you may have heard of the phrase autoimmune disease, and as I said, it's the body's immune system attacking its own central nervous system. There are currently more than 80 types of autoimmune diseases, that's 80, including Crohn's disease, Hashimoto's thyroiditis, rheumatoid arthritis, lupus, and type 1 diabetes. In MS, the immune system attacks and damages certain structures and cells within the central nervous system, including the myelin, which is a fatty sheath surrounding and protecting nerve fibers, oligodendrocytes, which is cells that produce the myelin, and nerve fibers underlying the myelin. So, who can develop MS? Basically, anybody can develop MS, but there are some patterns. There are 3 times as many women compared to men that develop MS. It occurs in a whole range of ethnic groups. Previously, it was believed that MS mostly affected white people, particularly those of European descent, but in recent years, studies have indicated that more black people have the disease than previously thought. Doctors are also seeing an increase in the rates of MS in Hispanic and Latin communities too. Studies suggest that there are genetic factors that increase your risk of developing MS, but there is no evidence that it is directly inherited. There are also environmental factors such as low vitamin D, and even cigarette smoking have been shown to increase the risk of MS. So, according to MS Society, we have 130,000 people plus with MS in the UK, and nearly 7,000 people are newly diagnosed each year. So, in England, that's roughly 1 in every 500 people, and obviously that's less for the other major countries, Scotland, Wales and Northern Ireland. I'll share links below for where I'm reading this information. So there are different types of MS, 4 main ones. There's no specific way to predict with certainty how MS will progress, but 4 basic disease courses, shall we say, have been defined. The first one is clinically isolated syndrome, or CIS. This refers to the first episode of neurologic symptoms caused by inflammation and demyelination in the central nervous system. I will tell you in a minute what neurological symptoms are and what that means. So, the second type is relapsing remitting MS, or RRMS. That's characterized by clearly defined attacks of new or increasing neurologic symptoms. These attacks are followed by periods of partial or complete recovery or remission. This is also known as flares. We call them flares in conditions like fibromyalgia too. The third course is secondary progressive MS, or SPMS. This follows relapsing remitting MS in some people and is characterized by a more progressive course with or without relapse or new lesions on MRI. There's also primary progressive MS, or PPMS, which is characterized as a gradual but steady progression of disability from the onset of symptoms with few or no relapses or remissions. Neurological symptoms. So, in general, neurological symptoms can be things like persistent or sudden headaches that are different, weakness or loss of muscle strength, double vision, memory loss. There are common symptoms of MS, such as depression and emotional changes, fatigue, something called MS hug, also known as dysesthesia, which is a squeezing sensation around the torso that can feel like when you have a blood pressure cuff on your arm and it tightens. It's the similar feeling. Numbness or tingling of the face, body, or extremities. Extremities meaning arms or legs. And legs, sorry. Pain and itching. Problems with memory and concentration. Vision problems, which can include blurred vision, poor contrast or colour vision, and pain on eye movement, walking difficulties, and general weakness. There are some other symptoms of MS as well to note, like bladder trouble, tremors, bowel troubles as well. I think I said numbness and tingling as well. Memory and thinking problems are also known as cognitive problems. Most people with MS, though, will be affected quite mildly cognitively. There are also 6 less common symptoms of MS. And don't forget, not everybody will get all of these symptoms. It varies from person to person and how severe their MS, where they are, the progression of the condition, etc. So hearing loss can be a part of the MS picture. So there's an example of one woman who said in her mid-30s, when she started having trouble hearing, which she and her doctor believed to be MS. So this is just an anecdotal example. She started to struggle understanding what people were saying. But it took years, unfortunately, for her to be diagnosed with MS. But people with MS who have hearing loss can experience it differently as well. Some people, like this particular lady I'm reading about, her hearing loss was progressive. The onset was sudden. And it can arise during an MS relapse or outside of a relapse, for example, during hot weather. It typically occurs in one ear only, and hearing acuity tends to get better over time. Other uncommon symptoms of MS can be headaches. Can be headaches such as migraines or tension headaches. Medication, physical therapy, and environmental changes can help. Breathing problems is another uncommon symptom, including shortness of breath, difficulty breathing deeply, and a pulmonologist may recommend medication. Some people may see a respiratory therapist who would recommend things like breathing exercises. There's also sudden intense itching that can occur anywhere on the body or face, and there are several types of medication that can reduce or take away the itch. Seizures can occur in people in MS. Many people who do have seizures with MS, thankfully the seizures tend to be mild rather than severe. They can involve brief episodes of unconsciousness or just a loss of awareness. It may or may not include uncontrollable movements of arms and legs and repetitive movement like rubbing hands. Some individuals experience generalized seizures which can affect the entire body. Again, there are medications that are quite successful in limiting these. I'm sure even though these seizures can be described as mild, I'm sure they're very upsetting and even frightening to people experiencing them, especially the first time or first few times until they're used to it. With the mobility problems of MS, it can make just walking and moving around difficulty, particularly if you have muscle weakness and what's described as spasticity. I've got to say, I don't really know what they mean by that. Let me Google. Oh, so that means stiff or rigid muscles. So that your reflexes, for example, when they, doctors like tap your knee with the little hammer thing, the knee jerk reflex can be stronger or exaggerated. It can experience also more clumsiness, difficulty with balance and coordination, also called ataxia. The shaking of limbs or a tremor comes under mobility problems. Dizziness and vertigo, which can make it feel as though everything around you is spinning. So, I think one of the common symptoms of MS that most people have even heard of is neuropathic pain. This pain is caused by damage to the nervous system. It can include stabbing pains in the face. It can also be a variety of sensations in the trunk, which is, your main body, abdomen, chest, etc., and limbs, including feelings of burning, pins and needles, a hugging or squeezing sensation. There are also muscle spasms, which can sometimes be painful. Then there is musculoskeletal pain, which is can be in the back, your neck, and joint pain. But this is seen as indirectly caused by MS, particularly for people who already have problems walking or moving around that puts pressure on their lower back or hips. Some people with MS can also have problems with thinking, learning, and planning. This is known as cognitive dysfunction. This can include problems learning and remembering new things, although long-term memory is usually unaffected. Slowness in processing lots of information or multitasking. a shortened attention span, getting stuck on words, problems with understanding and processing visual information such as reading a map, difficulty with planning and problem solving. People often report that they know what to do but can't grasp how to do it. Problems with reasoning such as mathematical laws or solving puzzles. Many of these problems, however, are not specific to MS and can be caused by a wide range of other conditions, including depression and anxiety, or even some medicine. Personally, I have some of these problems with, it's debatable whether it's caused by the ADHD or fibro or both. So there's some overlap. Many people with MS will experience periods of depression, but it's unclear whether this is directly caused by MS or a result of the stress of living with a long-term condition or both. Anxiety can also be a problem for people with MS, possibly because of how unpredictable the condition is, which of course is very understandable. In rare cases, people with MS can experience rapid and severe mood swings, suddenly bursting into tears, laughing, or even shouting angrily for no apparent reason. MS can also have an effect on sexual function. Men with MS often find it hard to obtain or maintain an erection. They may also find it takes longer to ejaculate when having sex or masturbating, and may lose the ability to ejaculate altogether. For women, problems can include difficulty reaching orgasm, as well as decreased vaginal lubrication and sensation. Both men and women with MS may find they are less interested in sex than they were before. This could be directly related to MS, or it could be a result of living with the condition. Again, this is some overlap with other conditions such as depression, and even taking antidepressants can cause all of the above symptoms. You may remember from previous videos, in particular the one about my personal experience of antidepressants. It seems that with a lot of chronic conditions, there's a lot of guesswork, as it's a case of the chicken or the egg, which comes first. Is the problem because of the condition? Is it a side effect of living with the condition or medication? Hopefully I explained that well. So there are also bladder problems common in MS. This can be having to urinate more frequently, unintentionally passing urine, which is called urge incontinence, difficulty in emptying the bladder completely, and recurrent urinary tract infections. But these can also have a range of causes other than MS. Bowel problems, which is constipation and bowel incontinence. Bowel incontinence is less common, constipation being the most common of the two. But bowel incontinence can be linked to constipation as well. Again, these aren't specific only to MS and can even be the result of medication that's prescribed for pain. I know that my pain medication, for example, the cocodamol I take, causes constipation. Some people with MS can experience difficulty with chewing or swallowing, called dysphagia, at some point. Speech may also become slurred or difficult to understand, known as dysarthria. So now I'm going to talk about diagnosing MS. So it can be hard to tell whether your symptoms may be caused by MS at first, because they can be quite vague symptoms or they can be similar to other conditions. Before I got diagnosed with fibromyalgia, they checked for MS first. So there's a lot of crossover of symptoms. If your GP thinks you have MS, you should see a neurologist, which is a specialist in conditions of the nervous system, for an assessment. Oh, I said earlier that neurologist is brain, but that's incorrect. I'm thinking of something else. So, no one single test can positively diagnose it. Other possible causes of symptoms may need to be ruled out first. It may only be possible to confirm a diagnosis. So it may also not be possible to confirm a diagnosis if you've only had one attack of MS-like symptoms. A diagnosis can only be made with confidence once there's evidence of at least 2 separate attacks, although this may include signs of attacks on an MRI scan that you may not have realised you have. Some of the tests you may need to confirm MS will be discussed by that. So, a neurological examination is one way your neurologist will look for abnormalities, including changes or weakness in vision, eye movements, hand or leg strength, balance and coordination, speech and reflexes. These may show whether your nerves are damaged in the way that might suggest MS. An MRI scan is also another way to check for MS. In case you don't know what an MRI is, it is a painless scan that uses strong magnetic fields and radio waves to produce detailed images of inside your body. It can show whether there's any damage or scarring of the myelin sheath, which is, if you remember from earlier, the layer surrounding your nerves. This myelin sheath they'll be looking at is in your brain and spinal column. Finding this can help confirm a diagnosis in most people with MS. Before I was diagnosed with fibromyalgia and I had an MRI, they said that they don't believe it was MS because I didn't have any lesions on the brain. There's something called an evoked potential test. There are several types of evoked potential test. The most common assesses how well the eyes work. Light patterns are shown to the eyes while your brain waves are monitored using small sticky patches called electrodes placed on your head. It is a painless test and can show whether it takes your brain longer than normal to receive messages. A lumbar puncture is another way of testing for MS. This is a procedure to remove a sample of spinal fluid by inserting a needle into your lower back. Spinal fluid is the fluid that surrounds your brain and spinal cord, and changes in the fluid can suggest problems with the nervous system. This procedure is done under local anaesthetic, which means you will be awake, but the area the needle goes in will be numbed. The sample is tested for immune cells and antibodies, which is a sign that your immune system is fighting a disease in your brain and spinal cord. Lumbar punctures are very safe but are often uncomfortable and can cause a headache that can last for a few days. A lumbar puncture will often be performed to provide extra information if symptoms or scans are unusual. Blood tests are also performed to rule out other causes of symptoms such as vitamin deficiencies or very rare but potentially very similar condition called neuromyelitis optica. Once a diagnosis of MS has been made, your neurologist may be able to identify which type of MS you have based on the pattern of your symptoms, whether you experience periods of relapse and remission or if those symptoms progressively get worse. The results of the MRI scan, such as whether there's evidence of lesions in your nervous system, have developed at different times and at different places in your body. The type of MS you have often only becomes clear over time because the symptoms are so varied and unpredictable. Unfortunately, it can even take years to make an accurate diagnosis of progressive MS because the condition worsens slowly. Treatment for MS depends on the stage of the disease and specific symptoms a person has. Treatment may include treating relapses with steroids, treating specific MS symptoms, treatment to reduce number of relapses with disease-modifying therapies. In the UK, you'll be supported by a team of different healthcare professionals working together. This is similar for the US as well. These may include a neurologist, a physiotherapist, a speech and language therapist, and a number of other professionals. The team will also include a specialist MS nurse who will usually serve as your main point of contact. You can contact your MS nurse or GP in the UK if you think you're having a relapse. Treatment for a relapse usually involves either a 5-day course of steroid tablets taken at home, injection of steroid medicine given in hospital for 3 to 5 days. Now, steroids can help speed up your recovery from a relapse, but they don't prevent further relapses or stop MS from getting worse over time. They're only given for a short period of time to avoid possible side effects such as osteoporosis or weak bones, weight gain, and diabetes, although some people still experience problems. Not using steroids more than 3 times a year, if possible, will also help to reduce the risk of side effects. Some symptoms of MS can be treated individually. One such symptom is fatigue. You may be prescribed medicine called amantadine for fatigue caused by MS, although this may only have a limited effect. You should also be given general advice on ways to manage fatigue, such as regular exercise, keeping healthy sleeping patterns, energy-saving techniques, and avoiding medicine that can worsen fatigue, including some painkillers. Specialist fatigue management courses or therapy, such as CBT or cognitive behavioural therapy, can also help people with MS cope with their fatigue. The doctor may also look at whether other things may be causing your fatigue, such as depression, trouble sleeping, or even medical conditions like anemia, which is low iron in the blood. It can then offer treatment if needed. Visual problems. MS-related visual problems will often improve on their own, usually within a few weeks, so you may not need any treatment. If symptoms are particularly severe, you may be prescribed steroids to help speed up the recovery. If you have problems with involuntary eye movements, medicines such as gabapentin can sometimes help. Some people with double vision may need help from ophthalmologists. Muscle spasms and stiffness can be improved with physiotherapy. Techniques like stretching exercises can help if your movement is restricted. If muscle spasms are more severe, you may be prescribed medicine to relax your muscles, which can either be baclofen or gabapentin. There are also other alternatives such as tizanidine, diazepam, clonazepam, and dantrolene. But these medicines can have side effects such as dizziness, weakness, nausea, and diarrhea, so it would be best, of course, to discuss with your GP or specialist MS nurse. If these medicines are not effective, you may be offered a 4-week trial of Sativex, which is a cannabis-based medicine sprayed into the mouth. Mobility problems. If you have problems with mobility, you might benefit from an exercise program supervised by a physiotherapist, specialist exercises called vestibular rehabilitation if you have problems with balance in particular. You can get medicine for dizziness or tremors, mobility aids such as a walking stick or occasionally a wheelchair, home adaptations such as stair lifts or railings. An occupational therapist can carry out an assessment of your home and suggest adaptations that may help. Neuropathic pain. So, neuropathic pain is caused by damage to the nerves and usually sharp and stabbing pains. It can also occur in the form of extreme skin sensitivity or burning sensation. These can be treated with medicines such as duloxetine, gabapentin, or amitriptyline. Duloxetine and amitriptyline are antidepressants, but these days are mainly used for pain control. Alternatively, depending on your pain, particularly with musculoskeletal pain, you may be given or asked to buy a device called a TENS machine, which is a transcutaneous electrical nerve stimulation machine. Problems with thinking, learning, and memory will be dealt with by a neuropsychologist and an occupational therapist who can assess problems and suggest ways to manage them. If you have emotional problems such as outbursts, like crying or laughing for no apparent reason, you can be assessed by a specialist like a clinical psychologist. They may suggest treatment with an antidepressant, and people with MS who also have depression can be treated with antidepressants or therapy such as CBT. If you feel anxious or worried, you may even be prescribed benzodiazepines, which are a type of tranquilizer that have a calming effect. If you have sexual problems, men can potentially be prescribed temporarily Viagra. That can be provided by the NHS for MS specifically. Relationship counselling or even a sex therapist may also help both men and women who are having problems with reduced interest in sex or difficulty reaching orgasm. For bladder problems, you can see a physiotherapist or a continence nurse. Handheld external stimulators can help some people start peeing or emptying the bladder. Occasionally, even a catheter can be inserted to empty the bladder when it's needed, but that's only on occasions, as it's very uncomfortable / painful. In rare cases, people with MS may even need a long-term catheter to keep the bladder emptying safely. You may be referred to a continence advisor or a urologist who can offer specialist treatment and advice, such as Botox injections, bladder exercises, or electrical treatment for bladder muscles. For speech and swallowing difficulties, a speech and language therapist can help you. It helps to find ways to overcome problems with speech and swallowing. For example, they can offer advice about foods that are easier to swallow, recommend exercises to strengthen the muscles that are used in speech and swallowing. On occasion, if swallowing problems are severe, some people may need to be fed using the tube which is fitted into the stomach through the skin. There is also something called disease-modifying therapies. So these medicines can help people have fewer and less severe relapses. They're taken either in pill, injection, or infusion form. They aim to reduce the amount of damage and scarring to the myelin sheath which is associated with MS relapses. These treatments may also help to slow worsening disability in MS, although definitive research in the long-term benefits is limited at the moment. Disease-modifying therapies aren't suitable for everyone with MS, and they're only prescribed to those with relapsing remitting MS or some people with primary or secondary progressive MS who have relapses. There's a lot more information out there about MS. It is a very complicated condition. Please let me know if you have MS or if you have any questions, if there's anything I can help with, or you just need someone to talk to. Feel free to message me on here, or you can contact me through Instagram. The link will be added below. I'll add links for what I found to do with MS below. If you need more specific help in other countries other than the US or UK, let me know. I can point you in the right direction. Thank you for taking the time to listen. I hope this was helpful or interesting or something. Just I think I will talk. So I love this lipstick. It's the Lisa Elridge. What colour is this? Blush. That's so pretty. It looks more red than I thought it would be. I thought it was like a deep pink. Maybe if I had put foundation or concealer on my lips and blotted out my little colour, it might be a bit more pink, but it's still really pretty. I'm not sure about the lashes, they are massive. I love that highlight. This blush is so pared back for me. I feel like the bronzer kind of drowned it out a bit as well. I got the gemstones to stick though. I'm going to take a quick selfie with the lashes and then take them off. Oh, my back hurts. I wish the my phone would pick up just how beautiful this eyeshadow is. I'm really happy with how it turned out. The mattes are a bit disappointing. I find the Pat McGrath mattes are not all that, but the shimmers are obviously stunning. I feel that they come out better with fingers, even compared to a wet brush, which for me is kind of surprising. This is the first time I've used, somehow I've never used a curved eyelash tweezer thing, and what a difference that makes to put in the Diamante on. Yeah. You can't even tell that I feel like there's like 5 different colours on my eyes in total. Powders. The glitter. Anyway, bye for now. Oh, music out. Get the whole look. I'm hoping with like the lighter colours, especially the blue, it was meant to give like spring vibes, but it would be if like the lip was a bit lighter. I'll probably take the lipstick off a minute, put a lighter pink one, and then take some selfies and add that to the Instagram post about this. Anyway, bye for now.